Amanda Roberts walked into a clinic and reported a cough that hadn't subsided in the past week. She tried common remedies, but they were ineffective. After she reported newly emerging chest pains, her doctor prescribed her a biopsy and an MRI to determine the source. Genetic analysis of biopsy tissue revealed the proliferation of cancerous cells due to a mutation in the RAS oncogene. All healthy cells go through a regular cycle of growth, synthesis, and division, which is known as the cell cycle. The G1 phase, often referred to as the growth phase, is the time in which a cell grows. During this phase, the cell synthesizes various enzymes and nutrients that are required later on for DNA replication and ultimately cell division. Then, the RAS protein irregularly prolongs the G1 growth phase, leading to overgrowth of the cell and the presence of malignant tumors. But how exactly does this work? The epidermal growth factor is the protein that starts the G1 phase. It binds to the epidermal growth factor receptor, or EGFR, which contains intracellular kinase domains. This is what causes the dimerization, or conjoining of EGFR, which in the end activates the kinase domains, which looks like this. Then the RAS protein is activated after the EGFR kinase has phosphorylated. The SOS and GRB2 proteins are used for this activation. That RAS mutation causes GTP hydrolysis, resulting in constitutive action, which means that it is always on. That causes increased growth and proliferation of cancer. Following the diagnosis for Amanda Roberts, the doctor suggested a new drug called MEKI, which targets the signal cascade pathway initialized by the activation of the RAS protein. MEKI prevents the phosphorylation of the ERK protein in the pathway, which is shown in the diagrams, thus disrupting the signal transduction and stopping the increased expression of genes that code for proteins such as cyclin D, and also slowing cell growth. There is still currently much research being done on creating and testing other drugs to treat RAS mutation-type cancers. Over the past several decades, cancer has grown to be one of the leading causes of death worldwide. There have been millions of people who have been diagnosed with cancer, but the death rates have been steadily decreasing as more viable treatment options are being designed and implemented. Cancer is often a long and debilitating disease. It places a great burden on sick people, especially because after one is diagnosed with cancer, they are very rarely completely cured, and the illness still must be managed. After a diagnosis, people need to exercise great caution and get frequent screenings to make sure the cancer is still in remission. Cancer is the second leading cause of death in the US, and there are likely many cancer cases that could be mitigated by constant screening, especially in older age groups. If a cancer is caught in early stages of development before symptoms appear, treatments would be more effective and thousands of deaths could be prevented because of greater chance of recovery. By the time symptoms appear, the cancer may have grown and spread. This can make the cancer harder to treat or cure. For many cancers, the chances of cure are largely dependent on the timing of the diagnosis. Also, for many common cancers, self-checks, which could be a first step to diagnosis and recovery, are often neglected or forgotten. During the COVID-19 pandemic, over 10 million people have missed their cancer screenings. It is important to remember that when your doctor suggests a screening test, it does not always mean he or she thinks you have cancer. Screening tests are done even when you don't have cancer symptoms.